This model here, it's uro and reproductive at the same time. So we have kidneys. I'm not going to do, this is just big structures because this is kind of not a good. So kidneys, our adrenal glands on top. We have ureters. We have the bladder, detrusor muscle of the bladder. We can see the trigone region here, urethra, another prostate gland. So we have a male. Here's our male, right? So we have, this guy is the rectum. Here's our bladder again. Here is our urethra, right? So if it goes through the prostate, it's prostatic urethra. When it goes through this urogenital diaphragm, we have the membranous urethra, so just a tiny portion of it is membranous. The rest of it is spongy urethra. For the female, again, here's her bladder, here's her urethra. We'll talk about other things later. So that's this guy. So another detail of the kidney, I'll use these boards for the details of the kidney. But we have kidneys, we have our adrenal glands on top. I guess we can turn it around. Of course, this is abdominal aorta. This is our inferior vena cava. We can see the pubic symphysis, and the bladder sits right behind the pubic symphysis. Here is our ureters, right? So from this side, you can see the ureters coming out. They go into the bladder. And this is male again, so it shows you these structures called vas deferens, and they're coming to deliver sperm from the testicles. So vas deferens comes up. We have seminal vesicles that create some of the semen, and we have the prostate gland, which also creates some of the semen. Okay, the bladder here, we can take off a portion of the bladder to show you the trigone. Okay, and then also the urethra, and we have the portion of the prostate gland. Oops. So that's that. These ones with the 3 boards, right? Because you can see a lot of detail here. So for the kidney, we have the capsule, right? The outer part that's actually pulled away here, that's the capsule. We have the cortex. The cortex comes down between the medulla in columns. So renal columns. This is a renal medulla. The tissue is medullary tissue. It's arranged in pyramids, so medullary pyramid is fine. At the end of the pyramids, we have ducts called papillary ducts, and they're actually better seen here. So you can see the holes of the papillary ducts that lead into the minor calyx, and so that is actually indicated here. There's number 10 with little dots there. But then there's the minor calyces. Here, at the end of every renal pyramid, there's a minor calyx. When 2 minor calyces come together, they're going to form a major calyx. And then right before we leave the kidney in the ureter, there's an area, wide area called the renal pelvis. Okay, so that's it. Again, adrenal gland, when you cut it open, the adrenal gland also has a cortex and an inner medulla. Okay, so let's move. So the blood supply here, we have renal artery, renal vein. Renal artery, once it splits, these are called segmental arteries. The segmental artery goes in between the medullary pyramids. These are called interlobar. Okay, all confused. Interlobar arteries. Interlobar arteries come across. These are called arcuate arteries. The arcuate comes into the cortex, called cortical radiate arteries, or you can call them interlobular arteries. Coming back out, this is an interlobular vein, the arcuate vein, interlobar vein, and then straight into the renal vein. Okay, so over here you can see the blood supply bigger. So we have, here's our arcuate coming in. Oh no, I'm sorry. This is our segmental. This is our interlobar. Here's our arcuate. Here's our cortical radiate or interlobular. And you can see a branch of the interlobular comes into the renal corpuscle, and that forms the glomerulus. Okay, so these balls are called renal corpuscles. You can also kind of see how we have all these capillaries here around the nephron, which is in white, and those are your peritubular capillaries. Okay, so for the nephron itself, we have the renal corpuscle. So let's follow this one. Renal corpuscle. Then this is the proximal convoluted tubule. It'll come down. This is the descending limb of the loop of Henle. We have the ascending limb of the loop of Henle. This is our distal convoluted tubule. Notice how the distal comes back around and hits the corpuscle again, and it goes into the collecting duct. The collecting duct will actually receive the filtrate from many different nephrons. So the collecting duct will come down. The end of the collecting duct is called the papillary duct. Okay, so our papillary ducts empty into the minor calyx there. Okay, so if we want to look at a corpuscle, that's what this is doing. We're opening the corpuscle. We have two components of the corpuscle. We have Bowman's capsule and we have the glomerulus. Bowman's capsule has two layers. This is the parietal layer, simple squamous cells, and we have the visceral layer, this pink peachy color, and which is actually the cells are called podocytes, right? And you can actually see these lines that the podocytes create. Those are the slit membranes. So those are those component of the filtration system. The glomerulus comes in via the afferent arteriole. Okay, it's cut open to show you the juxtaglomerular cells, and creates the knot of capillaries, which is the glomerulus, and then comes out the efferent arteriole. Here is our distal convoluted tubule. 37 indicates the cells are a little bit more squished and dense. That's the macula densa. The filtrate, so when the blood is filtered, all the fluid is caught here and it goes towards, it's drained into the proximal convoluted tubule. So this is the proximal convoluted tubule. And you can see the cuboid cells. It should be, they should have put long microvilli in, but because those cells have long microvilli. Okay? So I think that's pretty much it for this board. For some of you guys that were looking earlier, you can see some layers of the stomach here. So this top layer and here, this is all of the visceral peritoneum. So we can call it serosa. Okay, so you can say this is serosa, which is easier than visceral peritoneum. Then you have 3 layers of smooth muscle. So you have an inner oblique, and that's this part that's cut away. Okay, so there's your inner oblique. And then you have to kind of look carefully at the way the fibers run. So if the fibers run and they look like they're wrapping around the stomach, those are the circular muscles. If you look and they're running this way along the long axis of the stomach, those are the longitudinal muscles. Okay, so be careful with the fibers. We have the esophagus coming into the stomach here. If we pull this apart, you don't see a widening of the muscle for the lower esophageal sphincter, but that's where it would be, right here. Because the lower esophageal sphincter is not well developed, and that's why you have acid reflux or heartburn is very common. The cardia is the region of the stomach below the esophagus, so just in this area. The fundus is the region of the stomach that kind of comes up, like right above this line. The rest of the stomach is the body here. The pylorus is pretty much, we have a narrowing of the stomach wall, and then this straightaway here is the pylorus. So we have the pyloric region. At the end of the pylorus, we have a narrowing, so these muscles here, this is the pyloric sphincter, okay, that controls substances going into the duodenum, which would just begin right there. We can see rugae, okay. And I guess the other things would just be greater curvature, lesser curvature, and knowing that, you know, the lesser omentum comes from the lesser curvature up to the liver. The greater omentum hangs from the greater curvature over the intestines. Okay, so that's it. No blood vessels or anything here. So this one is very similar, has all the same structures as this, plus more. So I'm just going to go over this. So we have spleen, we have pancreas, we have duodenum, and then you see how there's a number 11 there? That's the jejunum. So as soon as the intestine stops its curve, it becomes jejunum. So we have our kidneys, we have our adrenal glands, we have our liver, a piece of liver, and behind it we have the gallbladder. So on the front, we basically look at the pancreas. The pancreas has a head, which is in this nook of this bend of the duodenum. We have a body and we have a tail. This midline duct is called the pancreatic duct. So all the pancreatic juice comes into the duct and it goes down. So this is still pancreatic duct. The one that comes up, this is accessory pancreatic duct. Okay, so pancreatic duct, accessory pancreatic duct. The pancreatic duct plus the common bile duct that you can see here come together, and the contents are secreted into the duodenum at this duodenal papilla. So this little region here is called the duodenal papilla. The bumps or ridges you see, these are called plicae circularis for increasing surface area. Right here you can see another opening for the accessory pancreatic duct. And that's pretty much for that. As we come around the back, I can ask you the passageway of bile. So basically we have the gallbladder, which stores bile, the liver that creates bile. From the liver, we have two little hepatic ducts. Okay, so we have a right and left hepatic duct. They come together to make the common hepatic duct. All right, and then from the gallbladder, we have a cystic duct. So when the cystic duct and the common hepatic duct meet, this is called common bile. Okay, so common bile comes down, and that's what you see coming down here, common bile. Okay? Right lobe, left lobe of the liver. We have the caudate lobe, quadrate lobe. We have the falciform ligament between the two lobes, the two larger lobes of the liver. Here's our gallbladder. Here's the porta hepatis. Those three structures of the porta hepatis are the hepatic portal vein, we have the hepatic artery, and we have the bile duct, common bile duct. And the reason why I'm calling it common bile is because if you look very carefully, we have the gallbladder and we have the cystic duct, right? And we go into the liver here, we have two branches, the right and left hepatic duct. They come together, common hepatic duct, and immediately when it joins the cystic duct, we have common bile. Okay, so that's the porta hepatis, those three structures there. Okay, and this is the inferior vena cava. So that's it for the liver.